This week on The Vet, we look at pets who are about to travel with their owners to other countries. Wilbur, who is about to go to the UK. Stella, who is heading for Italy. And Guns, who is going to the Lebanon. First in is Guns, who has a terrible skin condition.
He's always had a skin problem on the back. So he lost all of his fur here down both sides. And then Dr. Jalloh and the team, they sorted that out, so his fur's growing back. But he gets all these little bumps and like little, scratches. So he's always itching his back. He's always itching under here, chewing his paws. So it's like he's got an allergic reaction. And then with that, he gets tired and fed up. Then he gets grumpy, so you go to stroke him and he goes, growls at you. Tiny little growls. You see how he scratches his neck? Because he's always itching. His hair's growing back.
What do you normally feed him?
Well, I feed him beef. I was going to see if I can get the tins that you guys have, the winner lot and stuff.
Okay.
In case it's that. But we've tried every different food, hyperallergenic, dry food. It doesn't make a difference.
Guns is given a wash with a special soap.
He's a wild African dog. He's a good boy. His mother is here. This one here with the big ears and a fluffy tail. That'd be his mum. We used to call her Little Fox. The designer has been helping us with all the certificates and stuff to get the export.
Next in is Tricky, who has a serious case of worms and a bloated stomach as a result.
It's a serious one. But they eat.
Yeah, they eat.
Go for one, ma'am. And one makes we go for girl. This is now fluid now and get that in serious ones. Very just.
You don't really see. So you get serious worms. Just find out say you get worms. If they eat, they'll find out say his stomach is extremely, as you can see. So that's why we don't carry today, so they don't carry the worm out.
He also has what looks like a wound on his head. Teddy gives Tricky warm medicine before cleaning the wound.
Now you get this after 2 weeks for Gian. Quarter tablets back. Quarter tablets. Wrong Gian, because this now just warming. This belly go grow. They eventually go toilet. Wrong Gian. But the next 2 weeks, you just put her inside food. Yeah.
So they don't carry the worm out. And after 2 weeks, I have to do the same treatment back. You see that the worms are longer. Thank you.
Sam, so don't forget to forgive me.
Okay.
Seagull has come in for castration, but his owner did not know that dogs should not eat before an anesthetic in case they vomit and choke.
My name Seagull. We wanted a castrator. Just for Twitter and girl. I think this gets on. So do the one back.
Yes, sir. So what do we can do for this now?
Now they say they just give me 22 days here. I wanted a castrator.
Have you not eat this morning?
You get arrested?
Well, we get for delay and small. Because it's not before it actually. Yeah, so what we go do? We go see if there is a possibility for long. If you know, we just get into that treatment. Because we get the anesthetic, the actually is sick, a vomit choke, go down. So I don't know, food in the game or just
No, no, we know actually. So
yes.
If you know possible, bro.
Yeah, we'll not take risk.
When on Monday?
We do from Monday till Saturday, from 9 till 5. Like Saturday till 2 we supposed to have. That's an emergency.
When now we can more get chance.
So we'll see next Saturday.
Yes, possibly next Saturday.
Tricky cannot have this operation today, but a week later he is back. This time he has not had anything to eat.
This dog came last week, but unfortunately he has already eaten food. So because the surgical procedure dictates that no animal should have food before surgery, so we had to defer the surgery. So that's why they came this morning for the castration. We don't give the anesthetic because it's stress. Therefore, calm down like 1 hour, 45 minutes, he relax. Then we get the anesthetic down. So that will take like 2 hours. The whole post the dog 1 day a week before in the camp.
Man, I need Seagull. You can't castrate him today. We can't find him. So the advice we so we're not going to get it until 3 o'clock.
Next in is Wilbur. The cattle is going to the UK.
Alright, well this is Wilbur. She's a kitten, so she's about 2.5, 3 months old, and I found her tied up in a plastic bag on a rubbish tip. She was crying. So I took her to my apartment, and she will be coming back to the UK with me. Come on, Wilbur. Come on, good girl.
It's a situation that do evil that good may come.
Exactly.
So this is a classical example.
She seems very healthy.
What's her temperament, her behavior? She's
She's
okay?
typical kitten. She's nipping, biting, but that's what kittens do.
Oh,
so.
okay.
Right.
Just check her
Yeah.
temperature.
She won't like this.
I want to check her temperature.
How old do you think she is? She's about 3 months.
Little
isn't
over
she?
2 months, yeah.
Okay.
2 to 3 months.
Yeah.
So I don't know. You should come next week so we can give the rabies.
Yes.
Today we're giving the feline.
Perfect. And
Yes.
then next Saturday the rabies.
The rabies.
All right.
yeah.
I'm away in the UK, but I'll get someone else to bring her here next
Yes,
Saturday.
and okay.
Same time, 9 o'clock.
Yeah, yes, and
How long does the process take? Rabies is 30 days before she travels, I think, isn't it?
yeah. But like I said, you just need to check because I don't want to just guess.
Yeah.
But this has to do with traveling.
Wilbur, come on. Calm down. This is her calm down. Perfect. And you'll give me a certificate.
Yeah.
That's really good.
No, next week we'll get rabies.
Next week I'll bring her
Next
in.
week somebody
Well, my
is
friend
bringing-
will bring her in for the
Yes.
rabies. And I'll look up exactly the rules so that the rules for the UK. I'll look up. what's
Yes,
in it.
and then yes.
She's going to come back next Saturday for her rabies injection, for her first rabies injection. So she'll be coming regularly to get all the injections done that she needs to travel. I mean, she's desperate to get out, but I'm not letting her. She's at the moment, I'm keeping her indoors in the apartment. She's hard work. A kitten is hard work. You know, anybody that's going to get any animal, they're not easy to look after. And it's not easy here sometimes to buy things that you need for her, like dry cat food and litter and things like that.
Stella is in next, who needs to be microchipped, but first she needs the rabies vaccination.
The dog named Stella, we carry it and purpose it for let them microchip her. As dog they explain and get for travel. So before they travel, they must get for microchips in order for them able to identify the dog in case he lost. So that means without her.
Yeah, emotion. Zambiano. Mozzula, flesh. Always as a precaution. That they don't smell. Very small. That's with Zambi, man.
What are you saying?
Different countries have different rules about animal importation, so the owner always needs to check.
Okay, remove one now, don't
This dog will old 5 to 6 months now approximately. I would day Beach Road by Bendus Drive at the base.
Now, with the process that blood, you can come and see what we do right now. If I'm here for about 20 minutes, after 20 minutes, we'll invite you also to see how we centrifuge it, to separate the blood from the serum from the blood. We are sending the serum to England.
The blood will be sent to England, where it will be tested for various diseases, but most importantly rabies. And then the dog will be given a certificate of clean health. Next in is Caesar, a German shepherd with a serious skin disease, which is getting worse.
This dog I've been with me from 2008. So the name of the dog is Caesar. Caesar was doing well, but in this couple of months, just experienced this skin disease. So even my boss also feel discouraged about his skin. I must also feel discouraged because it's not suitable for we, because the whole place smelling over there to the house. So that's what we're doing today, to take care of this smell and
The kind of what I say, a dog we really get skin problem. But not a dog way too wild that way. We can lay it down, then walk out into it.
Then as I every 3 days you say the wash out.
Yeah.
It's waiting, nothing like the wash out.
Well, until you don't take 2 months and they don't give soap. I need to go buy soap for this. What's kind of soap? That's soap like the water with that.
The liquid soap.
Well, for now, I feel discouraged about the dog because of the skin problem. Then I don't really know what kind of medication they will give to him. Then I'm so worried if he will survive or not.
Unfortunately, most of the German Shepherd that we've been seeing for the last couple of years are not doing well in terms of this skin problem, because there is a massive wound all over the body. It looks like mange, but it's difficult to come back, because I don't know, it could be the temperature or something else, but most of these German Shepherd, to be specific, are not doing well here. So, and we are also advising pet owner and would-be pet owner not to make, it's a nice dog actually, but after some few years, it comes with a lot of complication that is difficult to handle. And their time is very sad because, like I said, a very nice pet, they make a nice pet, but at the end of the day, when you see them going down, and unfortunately you cannot help, it's a pity, it's difficult, it's very hard. Basically, it normally has some strange smell that the owner is always pissed off about, and that always break the bond, that pet and owner relationship, because it will reach a time then it will say, okay, the best we can do, we have to put the dog down.
For now, we never allow him to go inside the living room. Only me and usually give the disco, because even my boss man discouraged about Caesar now. But I told my boss man yesterday he need to comfort Caesar the same way you usually comfort him, so that maybe he will be healthy back again. You can't tell. But I mean, because Caesar sick, then everybody will avoid Caesar. It's not too distant. So I usually get the courage to Caesar also, the same way I usually get courage him before.
This is this in for castration.
For making them treat them, one castrate them enough. One young man get them, we 2 years again this. My name will use. That's when they call them this. So say they call them this.
Yes. So okay,
I've been come Wednesday. I will talk to Mr. Bar.
Yes.
But he tell me say castration. They say for treatment for I think it's a worms and waiting.
Rabies and all. Now for the castration, no?
Oh, because tell me so really different. The castration one price the inside. If you know the one, so
okay. Where you do it this morning?
Even tell me to make a noise for last night, so.
Oh, perfect. Well, you don't. The cause with that with the whole cause that's vaccination, castration, deworming.
The owners of the next dog bring the dog in because they think it has been in a fight. It is bleeding from the nose, but on further examination, Dr. Jalloh thinks it may be more serious than that, and the dog may have a brain tumor. Getting accurate information from the pet owners is absolutely essential, but can sometimes be difficult.
You have buy the paste, sir?
No, sir, I'm not
No, I need to forget the paste.
But it's until it's not treated, I say it will get infection. That's outside of me.
Okay, well, we'll check with the record book and see what is in here.
And then it can, say that account of that.
So what's in doing now after the not eat and done? Up, you know it from who stay Ikara?
From Thursday.
So from Thursday, you know it. Friday, you know it. Saturday, you sure?
Yes, sir.
Is they waka?
Waka.
No, but they eat small.
And the now they feed them, say yesterday, it's small.
Well, you tell me say you know it from Thursday. Not give me, listen.
Because the one is a thing.
Listen, give me correct information.
Okay.
Teddy can barely hide his frustration as this owner is unclear as to whether the dog has eaten in the last few days or not.
The one is a thing.
When I get it this morning,
Yeah, where I gonna?
who's can eating again?
Listen.
No, when I go getting canned food for the guy at this moment we're not able to go smell like able it. Yeah? So you go wait small, let them check with the record and let them come follow. It's with them in on the yard.
Last in today are Doggy and Jupiter arriving at the same time. Jupiter has a problem with his eyes and Doggy is in for a rabies injection.
Let's go. Hey. My name is Jupiter. Hi. You know the guy? The guy to have a problem. What's the reason I like it? I bring up him teacher. And then when I don't make this dog right here, it was just more like that one. You just get some funny thing in your eyes here. You just the type of secret animal.
We will handle that dog injection. Just get painkiller and anti-inflammatory. That we see. If you not go down by Monday, then I saw it. And the ear, yes. And the ear surgery is one of the most delicate ones. Yeah. So we get
one can castrate them. Can get rabies first.
It's the end of another Saturday and the clinic will now close down until next week.